Think about the last time you made a decision that seemed small but had big consequences. Sex is one of those choices that can have a lot of unexpected outcomes if we don't take precautions. It's a natural, enjoyable part of life, but without understanding the risks, you're rolling the dice. No one wants an unexpected health issue or surprise responsibility because of one night. What is risky sex? We all want to enjoy ourselves without worrying about what could go wrong. But some sexual behaviors can lead to serious consequences. Risky sex is any sexual activity that has a higher likelihood of causing an unintended result, whether that's an STI or an unplanned pregnancy. Examples of high-risk sexual behaviors. One common example of risky sex: going without a condom or another form of protection. Not using barrier contraception during vaginal, oral, or anal sex increases your chances of catching an STI or experiencing an unintended pregnancy. But it's not the only risky behavior out there. Here are some key examples of high-risk sexual behaviors. Not using barrier protection. It's as simple as it sounds. Condoms and other barrier methods are essential for reducing risk. Multiple sexual partners. More partners can increase the chance of encountering someone with an STI. Engaging in anal sex without protection. Anal sex poses unique risks. The rectal lining is more delicate, meaning it's easier for viruses and bacteria to get into the body. Mixing drugs or alcohol with sex impairment can lead to poor decision-making, and risky behaviors become a lot more likely. Paying for sexual services, or exchanging sex for items. While it's important to acknowledge that people may engage in sex work for different reasons, it does carry a heightened risk. Risks of unprotected sex without protection. The risks of unintended pregnancy and STIs go way up. Unintended pregnancy can be a life-altering event, and not everyone is ready for the responsibilities it brings. The most effective way to prevent unintended pregnancy: birth control. There are many types: condoms, pills, IUDs, and more. Each has its pros and cons, so it's crucial to consult a healthcare provider about what's best for you. STIs, what you need to know. Sexually transmitted infections are another major risk. They're sneaky, sometimes showing no symptoms, making it easy to pass them along without knowing. Some common STIs include syphilis, known for causing sores on the body, but it can lead to serious health issues if untreated. Gonorrhea, symptoms can vary by sex, or it may not show symptoms at all. Chlamydia, often symptom-free, but it's still easy to pass along to others. HIV, there's no cure, but medications can help manage the condition. Without treatment, it can progress to AIDS, which is life-threatening. How to reduce the risks now? Let's talk about ways to reduce these risks so you can enjoy sex with peace of mind. 1. Use protection. Barrier methods like condoms and dental dams are essential for safer sex. They help protect against STIs and unintended pregnancy by creating a physical barrier. Keep a few condoms handy so you're always prepared. 2. Regular STI screenings. STI screenings are like your car's regular maintenance. They're a good way to know what's going on and prevent any surprises. Many STIs are treatable, especially if caught early, so make routine checkups a habit. 3. Communicate openly. Being honest and direct with your partners about your sexual health and boundaries can lead to healthier and more fulfilling experiences. Talking about STIs, protection, and testing shows that you respect your partner's well-being as well as your own. 4. Lubrication for anal sex. Anal sex poses a higher risk because the rectal lining is more likely to tear. Using water-based lubricants reduces friction, which minimizes the chance of damage. Switching from anal to vaginal sex? Always use a new condom to avoid transferring bacteria, which can lead to infections. How drugs and alcohol affect sexual choices. Alcohol and drugs lower your inhibitions and can impair your judgment, making risky choices more likely. If you're under the influence, you may not be thinking about protection. Reducing your intake, or even avoiding it entirely before sex, can keep your mind clear so you can make safer choices. If you feel that alcohol or drug use is impacting your sexual health, it's important to reach out to a healthcare provider for support. The risks of exchanging sex for money or items. The CDC points out that those who exchange sex for money or items are at a higher risk of contracting diseases like HIV. This can be due to a higher number of partners or the lack of protection in some situations. It's also important to know the legal implications. In the US, this is illegal in most places, with some exceptions in certain counties in Nevada. For those engaging in these activities, the CDC recommends barrier methods like condoms to help reduce the risks. Consider pre-exposure prophylaxis, PrEP, if you're HIV negative, or antiretroviral therapy if you're HIV positive, to reduce transmission risks. Why safer sex is worth it. Sexual relationships can be powerful experiences. They can boost happiness, reduce stress, and even improve physical health. According to recent studies, sex can lead to lower heart rates and improved overall well-being. But the last thing you want is an unexpected health issue getting in the way of your happiness. Taking the right precautions allows you to enjoy a fulfilling, fun, and worry-free sex life. With regular STI screenings, open communication, and consistent use of barrier methods, you're setting yourself up for success. Wrap up. Take charge of your sexual health. Sex is a natural and enjoyable part of life. Understanding the risks and taking simple steps to protect yourself can help you have the best possible experience. The choice is yours. Be smart, be safe, and prioritize your health. You deserve a satisfying sex life without the added worry.